Welcome back to MCQs Master 101. In today's video, we're covering the top 50 Nclex prioritization trap questions that nursing students miss most often. Prioritization is one of the biggest reasons candidates lose valuable points on the Nclex. You'll practice identifying who to see first, applying ABCs, recognizing unstable clients, and avoiding common trap answers. Challenge yourself to answer each question before revealing the correct response. Let's begin.
Question 1. A nurse is assigned 4 clients on a medical surgical unit. Which client should the nurse assess first? A client with chronic obstructive pulmonary disease, COPD, who has an oxygen saturation of 90% on 2-liter nasal cannula. B, a post-operative client 2 hours after abdominal surgery reporting increasing restlessness and heart rate of 122 BPM. C, a client with type 2 diabetes mellitus with a blood glucose of 250 milligrams per deciliter and no symptoms. D, a client with heart failure reporting mild bilateral ankle edema. Answer: B, a post-operative client 2 hours after abdominal surgery reporting increasing restlessness and a heart rate of 122 BPM. Rationale: early post-operative tachycardia and restlessness suggest possible internal hemorrhage or hypoxia, an acute, life-threatening complication requiring immediate assessment. Question 2. The nurse receives report on 4 clients. Which client should be prioritized using ABCs and acute versus chronic principles? A client with asthma with expiratory wheezing and SpO2 94%. B, a client with pneumonia with new confusion and SpO2 88% on room air. C, a client with stable angina reporting chest pain relieved by nitroglycerin. D, a client with chronic kidney disease awaiting dialysis. Answer: B, a client with pneumonia with new confusion and SpO2 88% on room air. Rationale: hypoxia with altered mental status indicates impaired oxygenation, airway breathing priority, and acute deterioration. Question 3. A nurse must decide which task to complete first. Which situation represents a priority trap involving expected versus unexpected findings? A client with DKA with blood glucose 320 milligrams per deciliter. B, a client receiving heparin with APTT of 90 seconds. C, a client 1 day post-op with temperature of 99.1 degrees Fahrenheit, 37.3 degrees Celsius. D, a client with hypertension with BP 150 over 90 millimeters mercury. Answer: B, a client receiving heparin with APTT of 90 seconds. Rationale: critically elevated APTT indicates risk for bleeding, unexpected and dangerous compared to expected findings like mild post-op fever. Question 4. Which client should the nurse see first based on the concept of unstable versus stable conditions? A client with a spinal cord injury reporting new onset inability to void. B, a client with a hip fracture waiting for surgery. C, a client with chronic atrial fibrillation with heart rate 88 BPM. D, a client with controlled seizures requesting pain medication. Answer: A, a client with a spinal cord injury reporting new onset inability to void. Rationale: acute urinary retention may signal spinal cord deterioration, unstable neurologic change, requiring immediate evaluation. Question 5. A nurse is prioritizing care for 4 clients. Which client represents a circulation priority? A client with anemia reporting fatigue. B, a client with a femoral fracture and cool, pale extremity distal to injury. C, a client with pneumonia and productive cough. D, a client with anxiety and tachypnea. Answer: B, a client with a femoral fracture and cool, pale extremity distal to injury. Rationale: signs of impaired perfusion, possible compartment syndrome or vascular compromise, threaten limb viability and circulation.
Question 6. Which client should the nurse assess first when applying Maslow's hierarchy of needs? A. A client expressing fear about upcoming surgery. B. A client with urinary retention complaining of discomfort. C. A client with severe abdominal pain rated 9 out of 10. D. A client with shortness of breath and accessory muscle use. Answer: D. A client with shortness of breath and accessory muscle use. Rationale: physiological need takes priority over pain, elimination, or psychological concerns. Question 7. The nurse identifies a prioritization trap involving chronic versus acute conditions. Which client should be seen first? A. A client with chronic heart failure with baseline dyspnea. B. A client with asthma who suddenly stops wheezing. C. A client with diabetes with HbA1c of 9%. D. A client with chronic back pain requesting medication. Answer: B. A client with asthma who suddenly stops wheezing. Rationale: sudden absence of wheezing may indicate severe airway obstruction or silent chest, a life-threatening emergency. Question 8. Which client requires immediate intervention? A. A client receiving IV fluids with mild edema. B. A client with a nasogastric tube with green drainage. C. A client with chest tube drainage of 200 milliliters bright red blood in 1 hour. D. A client with constipation for 3 days. Answer: C. A client with chest tube drainage of 200 milliliters bright red blood in 1 hour. Rationale: excessive bright red drainage suggests active bleeding and requires urgent intervention. Question 9. A nurse is using the safety and risk reduction framework. Which client should be prioritized? A. A client with a history of falls requesting assistance to the bathroom. B. A client with seizure disorder whose bed rails are padded. C. A client with confusion attempting to climb out of bed. D. A client with stable vital signs requesting water. Answer: C. A client with confusion attempting to climb out of bed. Rationale: immediate safety risk due to potential injury requires urgent intervention to prevent harm. Question 10. Which situation reflects a priority trap involving first versus best action? Which should the nurse do first? A. Administer pain medication to a client reporting 8 out of 10 pain. B. Assess a client with new onset chest pain before giving nitroglycerin. C. Reposition a client with pressure ulcer. D. Provide discharge teaching to a stable client. Answer: B. Assess a client with new onset chest pain before giving nitroglycerin. Rationale: assessment precedes intervention unless delay is harmful. Chest pain must be evaluated to determine cause and severity. Question 11. The nurse is caring for 4 clients in a step-down unit. Which client should be assessed first using the principle of acute change versus baseline? A. A client with COPD whose oxygen saturation dropped from 92% to 90% on 2 liters oxygen. B. A client with heart failure who gained 1 kilogram, 2.2 pounds, over 24 hours. C. A client post-thyroidectomy reporting tingling around the mouth and fingers. D. A client with diabetes reporting hunger and a blood glucose of 72 milligrams per deciliter. Answer: C. A client post-thyroidectomy reporting tingling around the mouth and fingers. Rationale:
Perioral tingling indicates hypocalcemia due to possible parathyroid damage, which can lead to tetany and airway compromise. Question 12. Which client represents a priority trap involving expected postoperative findings versus complications? A client 24 hours post-op with mild incisional pain. B, a client 48 hours post-op with absent bowel sounds. C, a client 2 hours post-op with decreased urine output and BP 88/54 millimeters of mercury. D, a client 72 hours post-op with low-grade fever. Answer: C, a client 2 hours post-op with decreased urine output and BP 88/54 millimeters of mercury. Rationale: hypotension and oliguria suggest hypovolemia or shock, an immediate postoperative complication. Question 13. The nurse must prioritize based on laboratory critical values. Which client should be seen first? A client with sodium 130 milliequivalents per liter. B, a client with potassium 6.2 milliequivalents per liter. C, a client with hemoglobin 10 grams per liter. D, a client with WBC 12,000 cubic millimeters. Answer: B, a client with potassium 6.2 milliequivalents per liter. Rationale: severe hypercalcemia can cause life-threatening cardiac dysrhythmias. Question 14. Which client requires priority neurological assessment? A client with migraine reporting photophobia. B, a client with stroke history who suddenly develops slurred speech. C, a client with chronic back pain. D, a client with mild dizziness when standing. Answer: B, a client with stroke history who suddenly develops slurred speech. Rationale: sudden neurologic deficit indicates possible acute stroke, time-sensitive emergency. Question 15. A nurse identifies a prioritization trap involving pain versus life-threatening condition. Which client should be seen first? A client with pancreatitis reporting severe abdominal pain. B, a client with sickle cell crisis reporting 10 out of 10 pain. C, a client with chest pain and diaphoresis. D, a client with kidney stones writhing in pain. Answer: C, a client with chest pain and diaphoresis. Rationale: indicates possible myocardial infarction, life-threatening over pain severity. Question 16. Which client should the nurse assess first using the principle of airway compromise? A client with allergic reaction and swelling of lips and tongue. B, a client with pneumonia and productive cough. C, a client with asthma using inhaler effectively. D, a client with COPD with chronic wheezing. Answer: A, a client with allergic reaction and swelling of lips and tongue. Angioedema threatens airway patency and can rapidly progress to obstruction. Question 17. Which client reflects a priority trap involving vital sign trends rather than single values? A client with BP 140/90 millimeters mercury. B, a client whose BP dropped from 130/80 to 100/60 millimeters mercury in 1 hour. C, a client with HR 88 BPM. D, a client with temperature 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Answer: B, a client whose BP dropped from 130/80 to 100/60 millimeters mercury in 1 hour. Rationale: a downward trend indicates potential instability or shock, even if still within acceptable range. Question 18. The nurse is prioritizing based on risk of complications. Which client should be seen first? A. A client on bed rest for 2 days. B. A client with a central line reporting chills and fever. C. A client with mild dehydration. D. A client awaiting discharge teaching. Answer: B. A client with a central line reporting chills and fever. Rationale: possible central line associated bloodstream infection, CLBSI, which can rapidly progress to sepsis. Question 19. Which situation requires immediate nursing action using the principle of unexpected findings? A. A client with NG tube draining green fluid. B. A client with Foley catheter output of 50 milliliters per hour. C. A client with new onset unilateral leg swelling and pain. D. A client with mild nausea after medication. Answer: C. A client with new onset unilateral leg swelling and pain. Rationale: suggestive of deep vein thrombosis, DVT, which can lead to pulmonary embolism. Question 21. The nurse is caring for 4 clients in a telemetry unit. Which client should be assessed first using the principle of cardiac instability? A. A client with atrial fibrillation with controlled ventricular rate of 82 BPM. B. A client with ST segment elevation on the monitor but no chest pain. C. A client with occasional premature ventricular contractions, PVCs. D. A client with a history of angina relieved by rest. Answer: B. A client with ST segment elevation on the monitor but no chest pain. Rationale: silent myocardial ischemia is common. ST elevation indicates acute myocardial infarction requiring immediate intervention. Question 22. Which client should be prioritized based on perfusion and oxygen delivery? A. A client with hemoglobin of 8 grams per deciliter reporting fatigue. B. A client with carbon monoxide poisoning with normal pulse oximetry. C. A client with stable asthma. D. A client with controlled hypertension. Answer: B. A client with carbon monoxide poisoning with normal pulse oximetry. Rationale: pulse oximetry is misleading in CO poisoning. Oxygen delivery to tissues is severely impaired. Question 23. The nurse identifies a priority trap involving post-operative complications. Which client should be seen first? A. A client 1 day post-op with incisional pain. B. A client 3 days post-op with redness at incision. C. A client 8 hours post-op with sudden shortness of breath. D. A client 2 days post-op with constipation. Answer: C. A client 8 hours post-op with sudden shortness of breath. Rationale: sudden dyspnea post-op suggests pulmonary embolism, life-threatening emergency. Question 24. Which client requires priority endocrine intervention? A. A client with hypothyroidism with fatigue. B. A client with hyperglycemia of 280 milligrams per deciliter. C. A client with diabetic ketoacidosis with Kussmaul respirations. D. A client with stable thyroid nodules. Answer: C. A client with diabetic ketoacidosis with Kussmaul respirations. Rationale: DKA is a medical emergency with metabolic acidosis requiring immediate treatment. Question 25. A nurse must prioritize care using the concept of bleeding risk. Which client should be seen first? A. A client on warfarin with INR of 2.5. B. A client with platelets of 150,000 per millimeter cubed. C. A client with hemophilia reporting joint pain and swelling. D. A mild bruising. Answer: C. A client with hemophilia reporting joint pain and swelling. Rationale: hemarthrosis indicates active bleeding into joints, requires urgent intervention. Question 26. Which client demonstrates a priority trap involving respiratory fatigue? A. A client with asthma using accessory muscles. B. A client with COPD with chronic cough. C. A client with pneumonia with productive sputum. D. A client with oxygen saturation 95% on room air. Answer. A. A client with asthma using accessory muscles. Rationale. Indicates impending respiratory failure due to fatigue. Question 27. The nurse is prioritizing based on neurological deterioration. Which client should be assessed first? A. A client with head injury who is drowsy but arousable. B. A client with head injury whose pupils become unequal. C. A client with chronic headaches. D. A client with dizziness when standing. Answer. B. A client with head injury whose pupils become unequal. Rationale. Unequal pupils indicate increased intracranial pressure or brain herniation. Question 28. Which client requires immediate infection control intervention? A. A client with a low-grade fever. B. A client with productive cough. C. A client with neutropenia and a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius. D. A client with mild leukocytosis. Answer. C. A client with neutropenia and a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius. Rationale. Neutropenic fever is a medical emergency due to high risk of sepsis. Question 30. Which situation reflects a priority trap involving elimination versus life-threatening condition? A. A client with constipation. B. A client with urinary retention. C. A client with diarrhea. D. A client with no bowel movement for 2 days. Answer. B. A client with urinary retention. Rationale. Can lead to bladder rupture or kidney damage if untreated. Question 31. Which client should be prioritized using the principle of time-sensitive intervention? A. A client scheduled for routine dressing change. B. A client with stroke symptoms within 1 hour of onset. C. A client requesting pain medication. D. A client awaiting discharge instructions. Answer. B. A client with stroke symptoms within 1 hour of onset. Rationale. Early intervention, for example thrombolytics, is critical within the therapeutic window. Question 31. The nurse is caring for 4 clients in an emergency department. Which client should be assessed first using the principle of airway obstruction risk? A. A client with epiglottitis who is drooling and sitting upright. B. A client with bronchitis and productive cough. C. A client with asthma with mild wheezing. D. A client with COPD on home oxygen. Answer. A. A client with epiglottitis who is drooling and sitting upright. Rationale. Drooling and tripod positioning indicate impending airway obstruction, requires immediate intervention. Question 32. Which client represents a priority trap involving compensation versus decompensation? A. A client with metabolic acidosis with rapid breathing. B. A client with respiratory acidosis with confusion and lethargy. C. A client with mild tachycardia after exercise. D. A client with anxiety and hyperventilation. Answer. B. A client with respiratory acidosis with confusion and lethargy. Rationale. Altered mental status indicates decompensation and worsening CO2 retention. Question 33. The nurse is prioritizing based on fluid imbalance complications. Which client should be seen first? A. A client with mild dehydration. B. A client with fluid overload and crackles in lungs. C. A client with adequate intake and output. D. A client with dry mucous membranes. Answer. B. A client with fluid overload and crackles in lungs. Rationale. Pulmonary edema impairs oxygenation and can rapidly become life-threatening. Question 34. Which client requires immediate cardiac intervention? A. A client with stable angina. B. A client with heart rate of 110 BPM after walking. C. A client with ventricular tachycardia without a pulse. D. A client with controlled hypertension. Answer. C. A client with ventricular tachycardia without a pulse. Rationale. Pulseless VT is a cardiac arrest rhythm requiring immediate CPR and defibrillation. Question 35. Which client demonstrates a priority trap involving pain versus perfusion? A. A client with severe migraine. B. A client with abdominal pain. C. A client with leg pain and absent pedal pulse. D. A client with back pain. Answer. C. A client with leg pain and absent pedal pulse. Rationale. Indicates arterial occlusion, risk of limb loss due to impaired perfusion. Question 36. The nurse must prioritize based on electrolyte imbalance effects on the heart. Which client should be seen first? A. A client with sodium 132 milliequivalents per liter. B. A client with potassium 2.8 milliequivalents per liter and muscle weakness. C. A client with calcium 9.0 milligrams per deciliter. D. A client with magnesium 1.8 milligrams per deciliter. Answer. B. A client with potassium 2.8 milliequivalents per liter and muscle weakness. Rationale. Severe hypokalemia can lead to life-threatening arrhythmias. Question 37. Which client should the nurse assess first using the principle of bleeding versus clotting complications? A. A client with mild bruising. B. A client on anticoagulants with black tarry stools. C. A client with stable hemoglobin. D. A client with platelet count of 200,000 per millimeter cubed. Answer. B. A client on anticoagulants with black tarry stools. Rationale. Melena indicates gastrointestinal bleeding, requires urgent evaluation. Question 38. Which client represents a priority trap involving expected labor findings versus complications? A. A client in labor with contractions every 5 minutes. B. A client with fetal heart rate decelerations. C. A client with mild back pain. D. A client with cervical dilation of 3 centimeters. Answer. B. A client with fetal heart rate decelerations. Rationale. Indicates possible fetal distress, requires immediate intervention. Question 39. The nurse is prioritizing care based on risk for aspiration. Which client should be seen first? A. A client with nausea. B. A client with decreased level of consciousness and gag reflex absent. C. A client with mild dysphagia. D. A client with heartburn. Answer. B. A client with decreased level of consciousness and gag reflex absent. Rationale. High risk for aspiration leading to airway compromise. Question 40. Which client requires immediate intervention using the principle of shock recognition? A. A client with BP 120 over 80 millimeters mercury. B. A client with HR 90 BPM. C. A client with cool, clammy skin, BP 88 over 50 millimeters mercury and confusion. D. A client with mild anxiety. Answer. C. A client with cool, clammy skin, BP 88 over 50 millimeters mercury and confusion. Rationale. Classic signs of shock, requires immediate intervention to prevent organ failure. Question 41. The nurse is caring for 4 clients in a burn unit. Which client should be assessed first using the principle of airway injury in burns? A. A client with partial thickness burns on arms. B. A client with singed nasal hairs and hoarseness. C. a client with blistering on the legs. D, a client with pain rated 8 out of 10. Answer: B, a client with singed nasal hairs and hoarseness. Rationale: indicates inhalation injury and impending airway obstruction. Question 42. Which client represents a priority trap involving medication side effects versus toxicity? A, a client taking opioids with mild constipation. B, a client on digoxin with nausea and visual halos. C, a client taking antibiotics with mild diarrhea. D, a client on antihypertensives with BP 130 over 80 millimeters of mercury. Answer: B, a client on digoxin with nausea and visual halos. Rationale: classic signs of digoxin toxicity can lead to fatal arrhythmias. Question 43. The nurse is prioritizing based on sepsis recognition. Which client should be seen first? A, a client with localized wound infection. B, a client with fever and tachycardia. C, a client with hypotension, tachycardia, and altered mental status. D, a client with mild leukocytosis. Answer: C, a client with hypotension, tachycardia, and altered mental status. Rationale: indicates septic shock, life-threatening condition requiring immediate treatment. Question 44. Which client should be prioritized using the principle of renal failure complications? A, a client with creatinine 1.5 milligrams per deciliter. B, a client with potassium 6.0 milliequivalents per liter and ECG changes. C, a client with mild edema. D, a client with decreased urine output of 40 milliliters per hour. Answer: B, a client with potassium 6.0 milliequivalents per liter and ECG changes. Rationale: hyperkalemia with ECG changes can lead to cardiac arrest. Question 45. Which client demonstrates a priority trap involving stable chronic pain versus acute emergency? A, a client with chronic arthritis pain. B, a client with cancer pain requesting medication. C, a client with sudden severe headache and neck stiffness. D, a client with back pain. Answer: C, a client with sudden severe headache and neck stiffness. Rationale: suggests possible meningitis or subarachnoid hemorrhage, medical emergency. Question 46. The nurse must prioritize based on postpartum complications. Which client should be seen first? A, a client with mild uterine cramping. B, a client with moderate lochia. C, a client with heavy vaginal bleeding and boggy uterus. D, a client with fatigue. Answer: C, a client with heavy vaginal bleeding and boggy uterus. Rationale: indicates postpartum hemorrhage, requires immediate intervention. Question 47. Which client requires priority intervention based on infection risk? A, a client with a clean surgical incision. B, a client with WBC 11,000 per millimeter cubed. C, a client receiving chemotherapy with neutrophils 500 per millimeter cubed. D, a client with mild fever. Answer: C, a client receiving chemotherapy with neutrophils 500 per millimeter cubed. Rationale: severe neutropenia places client at high risk for life-threatening infection. Question 48. Which client should the nurse assess first using the principle of respiratory distress progression? A, a client with mild shortness of breath. B, a client with tachypnea and nasal flaring. C, a client with bradypnea and decreased responsiveness. D, a client with cough. Answer: C, a client with bradypnea and decreased responsiveness. Rationale: late sign of respiratory failure indicates impending arrest. Question 49. The nurse is prioritizing care based on gastrointestinal emergencies. Which client should be seen first? A client with nausea and vomiting. B, a client with abdominal distension and absent bowel sounds. C, a client with mild diarrhea. D, a client with heartburn. Answer: B, a client with abdominal distension and absent bowel sounds. Rationale: indicates possible bowel obstruction or ileus can lead to perforation. Question 50. Which client requires immediate nursing action using the principle of multiple system failure risk? A, a client with stable vital signs. B, a client with mild dehydration. C, a client with trauma, hypotension, tachycardia, and decreasing urine output. D, a client awaiting discharge. Answer: C, a client with trauma, hypotension, tachycardia, and decreasing urine output. Rationale: indicates shock progressing toward multiple organ failure, requires urgent intervention.
Congratulations on completing all 50 NCLEX prioritization trap questions. How many did you get right? Let us know in the comments below. If you found this video helpful, don't forget to like, share, and subscribe to MCQs Master 101 for more NCLEX practice questions, NGN case studies, SATA questions, and nursing exam strategies. Keep studying, keep practicing, and keep moving closer to your NCLEX success. Thanks for watching, and we'll see you in the next video.